Hello again, and thanks for staying with us. More on those headline stories for you throughout the course of the day. But let's have this discussion now. Unicef South Africa is warning that the measles outbreak is threatening the health of children across the country. The organization says infections have risen to 169 across 4 provinces, namely Northwest, Mpumalanga, Limpopo and Gauteng. It also says ensuring that children are vaccinated against measles and other preventable diseases is a matter of life and death. Let's get you more on this now. Bring in UNICEF's South Africa Deputy Representatives, Muriel Mafico, who joins us via our video link this morning. Great to see you. Thanks very much indeed for making time to speak to us, Muriel. I wonder as a start whether you could outline for us how serious a threat this outbreak is, especially as we head into the festive season.
We cannot overemphasize the threats, Ayanda. There is a lot of movement that usually happens with the holiday season, to be expected as families want to reunite. But because of the outbreak, which has already been reported in 4 provinces, and the likelihood of the spread is therefore very, very high. It's not just the internal travel that we need to be concerned about. We also know that there's cross-border travel that also happens. Yeah. So the agency, the sense of agency in addressing the outbreaks cannot be overemphasized.
Sure. How serious are the cases that we know of, these 169 that are reported across 4 provinces?
Maybe before going into the specific 169 cases, what we need to appreciate is the fact that even before the measles outbreak, we already had a number of children, almost 100,000 children in South Africa who were not at all immunized. These are called zero-dose children. They have not been immunized or protected against, the life-threatening preventable diseases. So that is the context. We were starting with children that already have not been immunized, and therefore they are particularly at risk. So the measles disease is actually highly, highly contagious, and it's also deadly. Particularly for children that have not been immunized. And that is why the Department of Health, working with partners such as UNICEF, WHO and others, has really come to the fore to swiftly address this issue.
Yeah, and we'll speak about whether or not we feel like we are addressing it with the urgency it needs. But for more understanding, at least as a start, I wonder if you can tell us how you're finding out about these cases. Is it incidentally because children come forward exhibiting symptoms and then you later realize that it's because they've actually contracted measles? Or are you getting a sense that there is a general awareness within communities such that when these symptoms come forward or are visible, parents or guardians go forward specifically to look out whether or not this is a measles infection?
The identification of measles cases is multifold. Of course, parents who are aware will notice that the child has a fever, the child has a runny nose, and therefore they automatically know they need to seek help. But you also have a good surveillance system in the country. And that is the surveillance system that is picking some of these cases and the awareness that we have been doing. In fact, as UNICEF, when the first cases broke out in Limpopo, and Limpopo was declared as a province affected by measles, we swiftly moved in together with the Department of Health, working with local partners and health workers to launch a campaign. So in the last 2 weeks or so, especially towards the end of November, there was a campaign launched in Limpopo to make sure that communities are fully aware of the measles outbreak and they take the necessary urgent steps that are required. And so this is the kind of work that we will be doing in the other 3 provinces that are also affected, in Northwest, Mpumalanga, as well as Gauteng. And then beyond in 2023, in February, there should be a national campaign to ensure that all children are fully protected.
This is important work, and my next question is not to downplay it at all, but I wonder whether there's anything else that could be done outside of just having these campaigns. I mean, at the height of COVID-19, and, I'm making this comparison aware of the very stark differences, but at the height of the COVID-19 pandemic, there were testing stations that were set up. Testing was made a whole lot more accessible. There was this almost aggressive push for people to know that there is this virus going about. Is there space for that when it comes to measles?
I think there is space for that, and that is why we're having this conversation. And that is why the national campaign is already being planned for 2023 to make sure that all provinces are covered. There is a sense of agency. Obviously, the health sector also requires strengthening. We know that the impact of COVID was huge on the sector, including the sector personnel as well who were affected. So we are now in a state where we need to ensure that we strengthen the health system broadly. We also understand what are those barriers that stop families from bringing children for vaccination. As I said, even before COVID and even before this measles outbreak, we had children who had not been immunized at all. So we need to invest in understanding the barriers that are stopping families from bringing children to facilities, whether it is issues around supply of commodities that are needed for the vaccination program, whether it is in terms of access and proximity to the health facilities. So these are some of the barriers that we need to actively address. I want to also mention that following COVID, there was actually a huge effort to invest in catch-up vaccination programs. And thankfully, we managed to reach the pre-COVID levels. But we should not be complacent. We should not be complacent, and that is why it's important that we aggressively address this current measles outbreak, but in tandem, we also strengthen the health sector as a whole.
Without a doubt. You speak about barriers. I wonder to what extent vaccine hesitancy is becoming a barrier, at least when it comes to treating and preventing severe disease from measles, because we do know it was a huge challenge when it came to combating COVID-19.
So there are issues around vaccine hesitancy, but I think the work that we are doing, the mobilization, helping families and parents to understand why it is important for their children to be vaccinated, helping them to also understand the importance of making sure that they follow the road to health card which they have, which clearly outlines the vaccines that their children are supposed to have. So there are aspects on both sides. We need to improve the awareness and knowledge of the families, but on the health system side, we also need to ensure that we address whatever barriers might be there and whatever weaknesses might be there. As UNICEF, we have been supporting the strengthening of provincial level health systems, focusing on the cold chain, which is the system that is used for storage of vaccines, and making sure that we maintain the integrity and quality of the vaccines. So that is the kind of support we have been providing, doing this alongside other UN agents as well, such as WHO, that have a key role to play in supporting the health sector.
Fair enough. I appreciate you may not be a clinician and there may be limitations to answering this next question, but what I've found is that typically people are more open to having discussions around vaccination when they better understand how a particular virus or disease works. Do we understand how measles works in the body? Can we even refer to it as a virus? I mean, those kind of elementary questions I think are useful to try and ventilate as we try and ascertain how best we could respond to these outbreaks.
You are absolutely right, and that is why we are deploying the truck. The truck is deployed to communities, and they have dialogue with the community. So when we deploy the truck, we have health workers on spot to talk to communities, engage communities, and demystify some of the fears that people might be holding. So it's important that we appreciate and we understand the concerns that communities might be having, and then we help them through the information that we disseminate so that they make the right choices. I think it's also important to know that making sure that all children are fully vaccinated is actually an important health security matter. So we all have an important role to play in making sure that the population is fully protected.
We know about the fluidity of migration between South Africa and neighboring countries like Zimbabwe, where we're told part of this outbreak may have begun. I'm not sure if the data has conclusively found that. But it does raise questions about whether or not we have any fighting chance of being able to bring the outbreak under control in this country without having some kind of transnational response to what's going on.
The transnational response is actually core. And in fact, you'll be happy to know that we are already liaising with neighboring countries. We are aware of the campaigns that are happening in neighboring countries. You mentioned Zimbabwe just now, and we are actually sharing information, making sure that the monitoring is up to date, making sure that campaigns are also being done in other countries, especially where they have already declared a measles outbreak. So yes, a regional approach is always an integral part of our response, particularly to outbreaks such as measles and other diseases.
An important discussion this. Thanks very much indeed for having with us. Muriel Mafico is with UNICEF. Once again, Muriel, thanks very much indeed for your time.